I had concerns that I might have Alzheimer's when I would forget how to get to places or forget how to get home from places.
He would go places and get lost. He would forget stuff. Then we finally decided to make an appointment with a neurologist.
Let's go right in here. Early diagnosis turns out to be critically important. So the first steps we do are talking to the family, talking to the patient, trying to understand if things like forgetting how to get to the airport is something that happens routinely or just happened once. You've already seen Dr. Womack and had your memory assessed, and the conclusion was you've had some changes in your memory. So the diagnostic tools we have, for me, fall into two categories. One are the clinical tools, what happened to the patient, what's the history, what are their tests on memory scores, and the other are the biological tools, what's happening in their brain, what's the underlying pathology. And those biological tools, we started off with spinal fluid tests, then we got brain imaging tests, amyloid PET scans, tau PET scans, and in the last few years, we've gotten blood-based biomarkers where we can see in the blood or the fluid in the brain if someone has amyloid plaques and neurofibrillary tangles, the hallmarks of Alzheimer's disease. And so we did this blood test called the Precivity AD2 test to see if we could detect changes in your brain that would tell us these memory changes were caused by Alzheimer's disease.
When I heard about the blood test, I was encouraged to come and have that done, find out if I was in the category of early Alzheimer's.
Many patients ask for and would prefer a blood test because it's convenient. It's a very familiar procedure to them. We've all had our blood drawn. It is less invasive and doesn't have the same risk as spinal fluid collection. It doesn't have the same risk and necessity of getting an injection of a radioactive compound as a PET scan does. And it can tell us a lot about if amyloid is present or not in the brain.
With the blood test results, his level was 99, and the highest you can get is 100. So he's basically confirmed that he has Alzheimer's. So the new medications and things are really important for us.
We have had 2 new drugs approved that are both antibodies that target a protein called beta amyloid. Beta amyloid is the protein that clumps together and forms the amyloid plaques that we see in Alzheimer's disease. So these 2 drugs have been approved, and they can clear those amyloid plaques out of the brain. That doesn't cure the disease in people who already have symptoms, but it does slow down their loss of memory and thinking by about 1/3 over a year to 18 months. So that's very exciting. What do you think you would gain from being on this medication, or what would your goals be?
Well, if we can slow the process down, that would really be a help.
Absolutely. Well, I think it's great that you have a positive attitude and still have things you want to accomplish. You know, maximize your quality of life, the things you can do, the time you can enjoy with your family, because, you know, our goal is to help you do that.
You know, I love to do research, and I've had my hand in developing some drugs that have been very useful for thrombosis and to prevent recurrent thrombosis and heart attack and stroke. And I really have a vital interest in continuing that. So being on a medicine like this is allowing me the great joy of continuing my work and collaborating with colleagues that are doing additional research in the area that I've started.
The key thing for people to know now is that there's a huge amount of progress being made. So we now have tests, we have treatments, and this is only going to increase as time goes on. So again, I think people need to know right now, if you see your loved one having memory symptoms, get them in early, and maybe in 5, 10, 20 years, get yourself in at the appropriate age, whatever that ends up being, to be tested with one of these blood tests so we can prevent this disease. It's great that we're all living longer, right? But we all want to live longer with a good quality of life and have our memory and our wits still about us. And I think that's becoming more possible now.